Breast Cancer Awareness Month is just days away, but now is the time to celebrate the hard work our doctors are doing to improve the lives of breast cancer patients. Today, 13 News Now reporter Megan Shin had the chance to speak with the only surgeon in Virginia offering patients a unique new technology in the recovery process. And Megan joins us with the story only on 13 News Now.
Hey guys, well, each year more than 100,000 women in the U.S. have a mastectomy to remove cancerous breasts. Now, 42% of those choose to have reconstructive surgery, and for those choosing to have reconstruction, tissue expanders are a necessity for implants. And today, we sat down with the only doctor in Virginia who has a new method of tissue expansion that could save patients time and money.
Samantha understands how it feels to be diagnosed with breast cancer.
I got the pathology report back the following week and found out it was DCIS.
Her diagnosis coming just 4 months after her wedding.
Your whole world is just turned upside down.
After having a double mastectomy to remove the cancer, she looked for the next step.
Now, when my husband found the article on AeroForm, I thought that was just a way of me taking control of some part of my journey.
AeroForm is a needle-free, patient-controlled wireless tissue expander. The FDA approved the instrument in December 2016, just in time for Samantha to reach out to Dr. Denk.
Samantha's the first patient in the United States to use it outside an investigational stage.
I emailed them and I said, this is what I want.
Hi, Samantha.
Hey, Dr. Denk.
How are you? My questions were answered in terms of the safety and the previous studies. I was certainly willing to proceed with it.
Traditional breast expansion means gradually enlarging with saline injections with a needle to stretch the skin and muscle around the chest.
Every 2 weeks for 4 to 5 months.
Instead, the AeroForm expander uses CO2 and a remote control to inflate anywhere, anytime.
Not uncomfortable at all.
Studies show on average the AeroForm takes 21 days when saline injections take 46.
Being diagnosed with cancer was traumatic enough, and then you loaded with all sorts of doctor's appointments. You know, one less doctor's appointment would make my day much more easier.
And Dr. Denk says there are pros and cons for each decision for tissue expansion. With the AeroForm, doctors have less control of the expansion process, but Dr. Denk says AeroForm has classes and tests for the patients to take so they know how to use it properly. And he also says the cost between both procedures differs between who you see, but that also depends on the AeroForm itself, and that could be about the same or less as a traditional procedure. Live in the studio, Megan Shin, 13 News Now.